Alrighty, so let's go through a week two quiz review. It's a mainly a lecture quiz review, but I did add stuff for lab as well. So it's almost a lecture and lab quiz review though for the skeletal system. So remember the functions of the skeletal system, right? Um, Number one, we're going to have support. Right? The skeletal system is going to be able to provide support, as it's going to be able to provide that framework for the attachment of other organs. It's going to be able to store minerals, right? The calcium, the phosphate. Most of the calcium and the phosphate in your body is going to be stored in your bones, right? As well as blood cell production. Remember, red blood cells, white blood cells, platelets, right? These are all going to be produced in the bone marrow. Bones also act as levers, so the muscles will actually pull on the bone to produce movement. And then your skeletal system really functions to protect. Your ribs are going to protect like your heart, your lungs, your thymus, right? Your skull is going to protect your brain. Your vertebrae is going to protect your spinal cord. And like those pelvic bones, they're going to be able to protect your reproductive organs. We know that, just going back for a second, the skeletal system is going to have two divisions. We're going to have the exoskeleton and the appendicular skeleton. I like this image right here. Right there, because it shows like in that teal, bluish, greenish color, right? That's the exoskeleton, and everything else, like in brown, basically, that's going to be the appendicular skeleton. So that exoskeleton is everything in the core, in the center, right, of the body, whereas the appendicular is really like the appendages, right? The stuff that's attaching to the exoskeleton, right? And so you want to be able to label, right, different bones. Okay. And we also want to be able to label different type of bones. So remember, we have like long bones. And so let me just zoom in just a second, right? And so, for example, this bone right here, the largest bone, largest and heaviest bone in the body, right? This femur. That's an example of a long bone, right? Long bones are long. They're longer than they are wide. So your femur, your tibia, your fibula, the humerus, right? The radius, the ulna, right? Even these phalanges. These are all long bones. Okay. Then you have bones such as those skull bones, right? These are flat bones, right? Being like the frontal bone, right? Those are going to be like flat bones. Okay. You also have like these ribs. These ribs are also flat bones too. These are also flat bones. Okay. Then you also have like irregular shaped bones. Well, let me go to short bones first, right? So we have short bones. Short bones are going to be like these bones in your wrist, right? Or these bones in your ankle. Okay. Those carpal and those tarsal bones, those are short bones. And remember the classification of a short bone. So short bones are like these cube or box shaped bones. All right. And so you're going to find those like in your carpal region, in your tarsal region. You also have those sesamoid type bones, those round, small, smooth bones, right? So some of them are going to be your carpal bones, but we really know that patella, right, is a sesamoid bone. Okay. And then we have those irregular bones, those irregular shaped bones, like such as your vertebrae, right? Or even your coxal bones, right? These would be examples of irregular bones because they don't fit in the category of short or long, honestly. They have really a irregular shape, right? So be able to know what type of bones, long, flat, short, irregular, sesamoid type bones and where they're located. And also know the different bones of the body too, right? Especially the ones in this image right here. Okay. So remember the different cells of the bone, right? So these bone cells. So let's start with these osteogenic cells or these osteoprogenitor cells. These are going to be those stem cells, okay? These will differentiate into forming osteoblasts. Osteoblasts, these build up bone. These are those immature bone cells. but they produce osteoid, right, which is that bone matrix, though, like that fluid portion that you can see right here. And so once these osteoblasts are completely surrounded by that osteoid, they actually mature and become osteocytes. So now these osteocytes, surrounded by this bone matrix, these are these mature bone cells that basically monitor and maintain the bone matrix. And I like how it has these extensions on them because it's like communicating throughout the bone matrix, right? Making sure everything is good, essentially. And then you have these osteoclasts with a C. Look, these are these multinucleated cells right here. And they're involved in the process of osteolysis, right? To cutting bone. So these osteoclasts, they will secrete an acid basically to dissolve the bone. So they break down bone, right? And so if they break the bone down, right, they're going to cause the release of calcium and phosphate ions, and that's going to go into the blood. So that brings us to the parathyroid hormone. Remember this, okay? Because parathyroid hormone is going to be produced by the parathyroid gland that's located on the posterior side of the thyroid gland. Parathyroid hormone is going to be released in response to a low blood calcium level. So if you have low blood calcium level, you'll release parathyroid hormone. Parathyroid hormone will then go from the parathyroid gland that's located in your neck, go to your bone, target these osteoclasts, and tell them to upregulate, basically. Okay, start breaking down bone a little bit more and put some calcium in the blood so we can bring our calcium levels back up. Okay? Parathyroid hormone also will go to the kidneys and tell you to stop peeing out calcium because you already don't have that much. So keep the calcium that you have, so reabsorb it. It also tells the kidneys to produce vitamin D. Okay, and so vitamin D will then go to your intestines and increase intestinal absorption of calcium. So it's like a three-pronged attack of increasing calcium levels in the body. So remember the structure of a long bone. So we just talked about long bone, right? But remember the structure. So the shaft is the diaphysis, right? The shaft, this long portion right here, is the diaphysis. The end portions are the epiphysis, okay? And so remember there's going to be a portion, between the diaphysis and the epiphysis, the metaphysis portion. And in this metaphysis portion, we also have this epiphyseal line, okay? And so you got to also remember through endochondral ossification, right? So most of our long bones, or all of our long bones, they were made up of cartilage first, right? And that cartilage being hyaline cartilage, right? And so through the process of endochondral ossification, we started to deposit bone here at that primary ossification center, right? This is the primary ossification center. This is through embryonic development, right? And then we start to deposit bone up here, right? And this is that secondary ossification center. And they started to grow. And what happened is that line of cartilage, as you were removing cartilage, that line of cartilage still was there. And then essentially it had closed up. So this line of cartilage has closed up between these two ossification centers. And that's what we know as that epiphyseal line. Okay. And that's going to be, again, made up of hyaline cartilage. Okay. So remember those different parts. Also, within this diaphysis, or this medullary cavity right here, this medullary cavity, this is where we're going to be able to produce those red blood cells, those white blood cells, those platelets, right? All those blood cells, we're producing there. We also have yellow bone marrow, right? In the medullary cavity as well. And that's going to be fat, right? This is going to be fat in adults. Okay. We're able to store some fat in our bone marrow. Okay. So also, let's look at the different parts of a bone a little bit more microscopically. So this compact bone right here, right? So the outer portion is made up of compact bone. This compact bone is going to be made up of these repeating units, right? Called these osteons, right? These osteons are going to be the bone unit, basically. These are the basic unit of a bone, okay? Basic unit of a bone. Again, these are going to be the osteons, okay? And so that makes up compact bone. We know that in the center, right? You see that porous nature right here, like in the epiphysis? That's going to be, that we see down here, spongy bone. Spongy bone is made up of trabeculae. Okay, so you remember that trabeculae. And so that trabeculae is going to be having a membrane around it. That's going to be called the endosteum. So the endosteum is the inner membrane, right? So it's going to be a connective tissue membrane that covers the trabeculae of the spongy bone. And of course, the outer portion of the bone is going to be covered by the periosteum. Okay. So remember that the skeletal system is going to be divided into the axial and appendicular skeleton. Remember both. Remember the axial skeleton will consist of the skull, right? Those meaning the cranium and the facial bones, those associated bones, the auditory ossicles and the hyoid, as well as the vertebral column, right, and the thoracic cage. This is all in the center. In the center of the body. That's going to be axioskeleton. Okay, remember those bones. Part of the axioskeleton, we're looking at the skull right here. Remember that the skull has these bones that are sutured together, right? So a suture is made up of dense fibrous connective tissue. So these are examples of a synarthrotic joint. And so remember these sutures, every single one, okay? So between the frontal and the parietal bones, we have this coronal suture, also called the frontal suture. Then we have between these parietal bones, the sagittal suture. We also have this between the parietal bones and the occipital bone, this lambdoid suture. Okay, remember that lambdoid suture as well. And I also want you to remember this squamous suture. The squamous suture is going to be between the temporal bone and the parietal bone that you can see right there. Okay, so remember all of these sutures. Okay. Also, you got to remember and understand the external anatomy, right? As well as the a bird's eye view over here. So when we're looking at the anatomy, you may be asked to label certain type of bones of the skull, right? So remember in the back, you got this occipital bone, right? Up top, that's going to make up the superior and lateral portions of the skull. Is going to be those parietal bones. On the superior portions of the head, you're going to have these temporal bones. These temporal bones, notice how they have this external acoustic meatus. This is going to be associated with hearing and balance, this temporal bone, okay? Because your hearing and your balance apparatuses are going to be located in your inner ear, and that's this bone overlies your inner ear, okay? Also, don't forget that sphenoid bone right here. That sphenoid bone. Let me just take a second to focus on that. So the sphenoid bone will articulate with every other cranial bone in the skull, right? So it's touching, as you can see, even right here on this image right here. It's articulating with the ethmoid bone. It's articulating with the frontal bone. It's articulating with the parietal bone. It's articulating with the temporal bone. And it's articulating with the occipital bone. So it's literally touching or articulating with every other cranial bone, right, in your skull. And it basically bridges the connection between the cranial bones and the facial bones. Now, within this sphenoid bone, you have this hypophyseal fossa of the sella turcica. And so this is like a little depression. And so what sits in there is the hypophysis. That's where this hypophyseal comes from. The hypophysis, like we mentioned, is the pituitary gland. Okay? And so we'll talk about it too, but I want you to also remember, so the pituitary gland is going to be important for hormone production, right? But even more so, it's going to be the hypothalamus. The hypothalamus is located superior to the pituitary gland, right? So it basically sits on top of the pituitary gland. And the pituitary gland sits in this hypophyseal fossa of the sella turcica. Okay, so remember that. Okay, and this is going to be of that sphenoid bone. Okay, and I give you again hypophyseal fossa of the sphenoid bone right there. It's like the little pocket, right, that protects, right, that pituitary gland. Okay, so let me now touch on the ethmoid bone. So this ethmoid bone right here, so let's zoom in a little bit. So you have this crista galli that's going to be able to separate the left and the right. And so you have this cribriform plate, right? And on this cribriform plate, this is where those nerves, those olfactory nerves, are going to come from your nose and enter the brain. And so it has these little holes. You see those holes in there, right? Those holes are going to be called cribriform foramina, right? So again, it's a foramina, like a foramen. So there's a round or oval passageway for blood vessels and or nerves to come through. Okay, so this ethmoid bone, right, is going to have that cribriform plate on it. Okay, and so I'm going to show you in another image a little bit more about that ethmoid bone, right, and how it's able to form the superior part of that nasal septum, and like forming like those nasal conchi as well. So we talked about the sphenoid bone, we talked about the ethmoid bone, we talked about the temporal bone, right? Let's talk about the occipital bone. This occipital bone that's going to be on the back, posterior or dorsal and inferior portion of the skull. It's going to have the largest foramen in the body. That's going to be called the foramen magnum. Okay, and this is where the spinal cord exits through. Okay, it's also going to have things such as this hypoglossal canal. This hypoglossal canal is going to be a part of that occipital bone as well, and this is where that hypoglossal nerve is able to come through. Okay, so let's also now talk about those fascia bones, right? So you want to remember this lateral image of the skull because you will be asked to label these, right? So let's start with the lower jaw, which is going to be the mandible, right? This large mandible right here, right? Notice how this mandible has the coronoid process. The mandible has this coronoid process. It also has the mental foramen, okay? Your upper jaw, which is going to be the maxilla, right? They're going to have those large paranasal sinuses, okay? Then you have your cheekbone, which is going to be your zygomatic bone. You also have your nasal bone right there. Don't forget about those lacrimal bones, those small bones in the face, okay? What else, okay? So this is another view. This is like an anterior view of the skull, right? But you can see the maxilla right there. And again, I tell you, they contain these large paranasal sinuses, right? That ethmoid bone, remember I was talking about that ethmoid bone? So it's that ethmoid bone that has this perpendicular plate, okay? And this perpendicular plate right here, it forms the superior portion of your nasal septum. And also you have these nasal conchi as well. Again, made up from that ethmoid bone, okay? Remember that. Also part of your axioskeleton, we have your vertebral column. So remember that we have these different curvatures: cervical curvature, thoracic curvature, lumbar, sacral curvature, okay? And of course, we want to remember C1 through 7, right? So C7, right? Or C1, C2, C3, obviously to C7. So 7 cervical spine, 12 thoracic, 5 lumbar, right? And we have 1 sacrum and 1 coccyx, right? So the sacrum, again, is going to be like 4 or 5 fused bones all into one, still making up one bone. And then the coccyx is going to be like 4 fused bones together, still making up one bone, okay? So remember those. But you want to remember also that we have primary and secondary curvatures. So primary curvatures are what you're born with. Primary curvatures would be thoracic and sacral. Thoracic and sacral are primary curvatures. And then after you're born, you're going to develop those secondary curvatures, which is cervical and lumbar. So remember those curvatures for me, please. Also remember that, you know, in the cervical spine, you have those transverse foramina, right? And there's going to be these holes right here, allowing for nerves and blood vessels to go through. You also have C1 and C2 up there in the cervical spine, right? C1, atlas, C2, axis. C1 gives you the ability to say yes, whereas C2 gives you the ability to say no. Remember that. And of course, these thoracic spine, that's going to articulate with that of the ribs. Okay. And so the sacrum, right? So remember, what's on the outside of the sacrum? It's going to be those hip bones. So that pelvic girdle, right, articulates with the sacrum to make up the pelvis. Okay. And remember that the coccyx, notice how there's essentially no holes there. So the coccyx has no canals or foramens going to be there. Okay. So no nerves or blood vessels will pass through that coccyx, that tailbone. And so this is like true spinal curvature, right? Perfect spinal curvature. And we know that scoliosis, right? Scoliosis is going to be a disease that can result from abnormal lateral curvature of that vertebral column, okay? Now, the appendicular skeleton. So the appendicular skeleton is going to be the limbs, right? Upper limbs, lower limbs. And it's also going to be the pectoral girdle. Pectoral girdle is going to be the scapula and the clavicle, as well as the pelvic girdle, right? And those are just those two hip bones. And notice how I just circled those two hip bones. I didn't circle the sacrum, right? Because the pelvic girdle is just the two hip bones. The pelvis is those hip bones, like, again, plus the sacrum and coccyx, right? So remember that difference. Now, let's talk about the pelvic girdle and the upper limb. So again, the pelvic girdle is going to be made up of the clavicle and the scapula, okay? I want us to also focus on this humerus. This humerus is going to be in the brachial portion, right? In the arm portion, right? It's going to be one. One bone is going to be in that brachium, okay? And so this humerus, so you're going to have the head of the humerus, that's going to be able to form that ball and socket joint with that glenoid cavity of the scapula right here, as you can see. Of course, when we have the shaft of the bone, that's that diaphysis portion. So, for example, if you have like, for example, what if you have like a fracture, right, in the shaft of the bone? We know that that's going to be in the diaphysis portion of the bone. So when we're looking at the proximal epiphysis, which is up here, this is proximal because it's closer to the attached base. Down here is the distal epiphysis. In the distal epiphysis, rather, right, we're going to have this capitulum portion, right, between these condyles. And this is basically where we're going to have that ona going to articulate there. This is where the ona articulates, okay? And so remember these different parts of this humerus, okay? Also, let's see what else. We want to also look at the other bones that's going to be in the upper limb too. So remember, for the humerus is going to be in the brachium, right, in the arm. And then we have these bones that's going to be in the forearm. So those bones are going to be like the ona and the radius, right? Or the radius and the ona. And so you'll see that the ona will have a radial notch, okay? And so you'll also see this interosseous membrane between them. And that interosseous membrane is going to be there for the attachment of more muscles and ligaments and things like that, okay? For the ona, you also have, well, I just mentioned it right here, right? This radial notch is going to be on the ona, okay? And you're going to have an onal notch on the radius, okay? And so remember those two portions, okay? And again, these bones, humerus is going to be in the brachium. These bones right here, the ona and the radius, these are going to be in the antebrachium, okay? Remember that. Remember where they're located anatomically. Alrighty? What else? Okay. Let's look at the pelvic girdle and the lower limbs now. So, the pelvic girdle is going to be the two hip bones that I'm circling right here, right? That's the pelvic girdle. If you add in the sacrum, right, and the coccyx, then you have the pelvis. Okay, so those are the portions of the pelvic girdle, right? It's just these two hip bones, nothing else. Okay, nothing else, right? And so that femur bone, which is right here actually. So the femur bone, look at the head right there. The head of the femur will make up that ball and socket joint right here. So to articulate there within that hip bone and that acetabulum. Okay. We also have the part of the leg or the inferior portion of that lower limb, right? Which is going to be the tibia and the fibula. So the tibia is going to be the inside portion, right? The medial bone. Okay. It's going to be that large, right? Medial bone. And then you have the fibula, which is going to be that lateral, like smaller bone though, but still you're going to have that interosseous membrane there as well. So remember that the fibula will have a lateral malleolus. This lateral malleolus is going to be important for basically articulating with that of the talus or those tarsal bones. Okay? So remember the fibula has the lateral malleolus because it's on the lateral portion of the leg. And remember the tibia, right, has the medial malleolus, okay, because it's on the medial portion of the leg. And don't forget these joints, right? So we have synarthrotic joints. These are immovable, where two bones are fused together, such as your skull or like your teeth in your jaw. We have amphiarthrosis. That means that joint has slightly movability, right? So it's slightly movable. So it's both stiff and slightly movable. And so I'll give you an example of like the pubic symphysis, right? Right, those synchondrosis type of joints. And then we have diarthrotic joints, and all diarthrotic joints are synovial joints because they are all freely movable. So your shoulder joint, your knee joint, things like that, right? These are synovial joints, and they're going to have like a synovial fluid in there. That synovial fluid is going to be able to nourish that cartilage there, okay? This is going to be a lecture and lab quiz review. So remember the different topics of the bones, okay, in the skeletal system, okay? Have fun.